So hello, welcome everyone back to the day two of the telepsychiatry training. My name is Dr. Frank Corrigliano, and we're going to do a few things today. First, we're going to finish up some of the presentation that a lot of the information that Dr. Heiler wants to give to us. We're also going to introduce Dr. Harrison Ross, and then we're going to do brief introductions about, I think everyone was here last week, but just to put faces to names again. And then we'll also talk about what the experiences were like doing the buddy system, installing the software, signing on to the software, and doing a 45-minute session or a couple of sessions that add up to 45 minutes, and see how that went, if there were some problems that you ended up troubleshooting and solving, and how that went. So it's a good time to sort of share those experiences as well. And then we'll do a few case studies and sort of dive a little bit deeply into those. Sound good? Okay, so Dr. Ross, do you want to say hello?
Is this mic working?
Yeah.
Oh, we didn't touch that.
Yep.
Yeah, I think it's working.
Because projecting is not my kettle of tea. Is that, can everyone hear me? Yes.
Yes.
Okay. My name is Phyllis Harrison Ross, and I want to first, on behalf of the New York Society for Ethical Culture, welcome you. This is an educational and religious institution that focuses on ethics and the worth and dignity of all human beings. We don't have a creed, we focus on deed. So that's, and you're all, of course, invited to come and to our many programs that we have during the course of the week. I chair the Social Service Board. The Social Service Board has a televisiting program. And I come to this as like one of the old ladies of this kind of business who was mentored to do it professionally by Dr. Heiler many years ago, when he was doing it with the State Office of Mental Health and the State Department of Corrections. And at that time, I sought him out because I was doing, in my private practice, video conferencing that had been set up. I had a big, huge Hollywood star as a client, and he had 2 wives and 1 concubine who had children. And when he was on location around in different places in the world, he wanted to be able to talk to the children. So he had his staff set me up in my office so that his children could come to my office and talk to the pops. Then that really was the beginning of my interest, and then I began to see how that would in fact enable me to extend the skills that I had as a psychiatrist, as a child psychiatrist, as a pediatrician, someone who's interested in forensic psychiatry, be asked to come here, there, all over to work, but I really couldn't afford the traveling time. So I thought, gee, this would be a good thing to do telepsychiatry with. And who's doing it? Well, Steve Heiler was doing it. And he really, he very patiently and gently introduced me to the topic. Now, currently, at the age of 78, I am a commissioner for the New York State Commission of Correction. You said, what is that? That our responsibility is to regulate all jails, prisons, and lockups in the state, to investigate all deaths, supposedly to make sure that there's a safe, stable, and humane environment. I know you're probably all saying, well, you aren't doing a very good job of that, especially at Rikers, but believe it or not, we are trying to do that. And telepsychiatry, because we can't get really good competent psychiatrists to see patients and to supervise the other clinical staff that work there. Telepsychiatry is something that we are trying to build up in terms of clinical service delivery. And you've heard, Frank, I'm sure, has talked at length to you about our supervised visitation program. So it's a wonderful medium. I'm so happy you're taking it. I hope that all of you will become telepsychiatrists so that we can hire you in our state correctional system. And I want to thank you very much for giving me this opportunity to proselytize. Thank you.